Okay, so I did my brochure on radiation protection in chest imaging. So what you see in a chest x-rays. So chest x-rays produce images of your heart, lungs, blood vessels, airways, and bones of the chest and the spine. They can also show in or around your lungs. If you come to the emergency room with chest pain or a chest injury or shortness of breath, you will typically get a chest x-ray. The image helps doctors to diagnose the cause of the problem and make accurate diagnosis. Chest x-rays help determine whether these are heart problems, pneumonia, broken ribs, or any other several conditions. A chest x-ray can also reveal many things inside your body, such as calcium deposits, the condition of your lungs, or devices such as a pacemaker or catheter. There are many ways to protect a patient when performing a chest imaging procedure. These steps are used in medical imaging procedures every day and are very important to protect the patient from unnecessary radiation exposure. During a chest imaging procedure, a lead shield should be utilized to protect the abdominal area below the lungs from radiation exposure. This is especially important for children, pregnant women, and individuals of childbearing years. However, it is still important for all patients in general. A common type of shielding for chest imaging is a freestanding, adjustable mobile shield placed between the patient and the X-ray tube. There is also the opportunity for a vinyl-covered lead shield that ties around the waist to be used if it is provided by the facility. These shields should be placed from above the hips and reach down to the mid-thigh area. By shielding, you are protecting any other organs or soft tissue from receiving any unnecessary radiation dose. So collimation. The purpose of collimation is to protect the patient by limiting the primary beam to the anatomical area of interest. The recommendation for collimation implies that the beam must be collimated to the smallest area of interest consistent with the goals of the examination. The beam must be collimated to the size of the image receptor or smaller, and the evidence of collimation should be seen on the image. Collimation is under the direct control of the operator, and every effort must be made to ensure correct collimation of the primary beam for every X-ray examination is used. Careful collimation is very important in chest X-ray. So, proper technique and positioning. There are many technical factors that fall under the responsibility of the radiologist to ensure the safety of the patient when it comes to radiation protection. To keep the amount of radiation exposure accurate, the radiologist taking the exposure needs to consider the technical factors that work together to provide the radiation to produce an image. Along with the technical components, there is positioning aspect. The goal of producing an X-ray is to create an image that is adequate for diagnosis to be achieved. A big factor within that is the body position of the patient. It is important to assure correct body positioning when working with the patient to be sure how to have the anatomy of interest visualized within the image receptor, and the position allows for the diagnosis to be made clearly and accurately. Reduce the possibility for repeats. By ensuring patient's identity and confirming the area of interest, you are keeping someone from being exposed to unnecessary radiation exposure. Once you have ensured the patient and procedure are correct, the next step would be to ensure the techniques are not too high or too low. By ensuring the techniques are in the right ranges, the patient won't receive more radiation than necessary, and the image will be adequate enough to make a diagnosis and avoid a repeat. By taking your time and not rushing, you can avoid mistakes in overexposing the patient. By keeping the patient calm, it will also help make sure the position of the patient is correct and there won't be a need for repeat exposure. And that is my works cited page.